Hey, what's going on, you guys? Hey, thank you for watching this video. In this video, I want to talk about a little meeting I had last night. I went to an investors meeting for like a medical product, new medical device. Invited by a friend, and didn't really know, what I was gonna encounter there. But I thought it was really interesting, and I thought I'd share that with you. So what the most interesting part of the night was is actually not anything to do with the actual product or the pitch or anything like that. And I don't know if I'm going to invest in it or not. Seems like a good idea, but the number one problem with doctors is that they invest in the wrong things and they lose money. So that's very important to know. You have to have insight to your problems, or at least the problems of your group. That's maybe a little tidbit. Doctors think that they're smarter than everybody, which probably not. It's hard work being a doctor, but I'm not totally convinced we're as a group smarter than average people. I think there probably are smart doctors, like for real high IQs, but yeah, I think anybody can do it with an average IQ. That just works really hard. So anyway, I got sidetracked, but the most interesting thing in the entire night was this 55 probably year old orthopedic surgeon was there, and I chatted with him a little bit, and he kind of has been in the medical device industry, creating medical devices and also being an orthopedic surgeon for a really long time. So as you guys know, I'm super interested in kind of branching out and not just being a doctor or surgeon or whatever, and kind of being multifaceted person. So what he said kind of is a little bit contrary to that advice right there, but what he said is, somebody asked him, wow, you've been doing this for 20 years, what would you have done anything differently, or do you have any advice for anyone? And he said, yes, for a long time I was in a group practice and I did everything, general orthopedics, and so he just went out there and took everything, and if a shoulder came in, he'd do it. If a knee came in, he'd do it. If an elbow came in, he'd do it, right? He didn't really, oh, nice move, what an asshole right there. Puts the blinker on, goes to turn like this, and I'm gonna follow, right? And then decides no. Fucking jackass. Anyway, so you have to be multifaceted when you are making videos and driving in a car, and you wreck your fucking car. So he said that he was in a group practice for a really long time. So, and what they did in a group practice is they took everything, and any orthopedic stuff, I guess, he took. And so he was kind of like general orthopedics. He didn't really specialize in a certain operation or a joint or anything like that. He just did everything. It was like 15 years or something. And then for the last few years, he went out on his own doing a solo practice and specialized in one thing. So all those years of training and med school and blah, 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 and he only does like basically one joint now. So that's interesting. And he said that he wishes he would have done that earlier, because that's where his value is, and I gathered from the conversation is that's where his practice is more lucrative. And you feel like when you're a specialist and you do one thing that much, you have this kind of thing that happens, which is, I've had it before, and I kind of know what he's talking about. He was talking about, like, you have you're more of an expert in your craft, and you can take pride in that craft a little bit more. because you're so good at it. You know all the little teeny nuances of everything. You know, you're way better than everybody else at it. And I can see that. I have talked about doing multiple things, right? Being a doctor and like having a business on the side and all that stuff. So this kind of contradicts what he's saying, is to be, more of a specialist. Of course, he is doing two things. He's an orthopedic surgeon, specializing in one joint specifically, and then also creating medical devices. So he is also branching out. So I guess if you could be more what he's suggesting is if you could be more focused in the things that you do, maybe you can do multiple, pursue multiple avenues of either business or doctoring, surgery. I think I just made that up. Pretty sure. But you focus your niche down. So the concept of a niche, if you listen to people in business, they talk about this a lot. And to niche down, that's the most, that's very important, because you understand who exactly is, say, buying your product, and what their pain is and what their pleasures are and all that stuff, and then you can make a product directly for them, and then when you find those people, they're much more likely to buy it instead of casting a wide net. So I found it interesting that this guy, after doing this for 20 years, said that was the number one advice he would give to people, is to basically, he was saying to niche down and focus, narrow your focus much more than most people do. And I think if you look at, successful people, that's kind of what they do. And I kind of think I f***ed that up a little bit. I went into general surgery. I mean, God, the name right there is like pathetic. General, just everything, right? General surgery, I do everything. And when you come out of residency, you kind of want to do everything. And I don't necessarily think that guy could have done that directly out of residency. I think you need a period of time where you do lots of different things. You figure out what you're good at, what's your advantage. I think this is very important, as a lot of people don't use their natural advantages in life. I mean, we have 7 billion people we are competing against, and so you need to use your natural advantages. And so he's going to, for him, he needed time to figure out what he was good at, what his natural advantages were. If it was a knee, or it was an elbow, or it was a shoulder, I don't know. I don't think you can do that right away. You may miss your natural advantage and then start doing something that, you're not that good at, and find out, well, shit, there's a lot of people that are way better than me. Maybe I do need to do something else, and then you switch, you know what I'm saying? So I think you do need to kind of broaden your net at first, whatever you're doing, and then narrow it as you can, and then finally decide on, very narrow focus. I think it's really important. Which, by the way, is kind of what I've been doing over the last several years, and I've been really pissed off at myself because I haven't been able to focus and niche down. I know it's important, like I see it, everybody talks about how important niching down and narrowing your focus, being laser focused is, and I can't fucking do it. Like every time I pick something up, I'm like, this is it, I've just had a difficult time, and I felt like, I did really well with that website, and that was I had an advantage at that time when I built that website in 2007 in residency. I had a big advantage over everybody else. I was basically the first one to build a website for that product besides the main company, and I was way ahead. And since then, I've tried these different things, and I haven't been able to really get traction, and everything feels like it's a big struggle. That's because I don't have an advantage, I think. I'm just talking this shit out right now. But I feel like maybe these videos are, maybe I'm an advantage with this, because I went through med school, was an IMG, I did surgery residency, now I'm out. I've been doing it for a while. I don't suck at it. you know, and I can talk on the camera. On the camera, I don't know why I said that, but I can, you know, talk to a camera, and so I feel like those things are kind of to my advantage, and maybe that's why I got a little more traction than my other projects that I tried. To sum up, I guess, is make sure you're focusing on focusing, you know? So make sure you're at least concentrating or aware of the things that maybe you could niche down into or narrow your focus to. You may not be ready to focus. You need to get a broad understanding of whatever it is you're doing. If it's medicine, if it's surgery, if it's nephrology, right? If you want to be a urologist, maybe you got to be a general urologist for a while before you figure out what your focus should be and what your advantage is. But be cognizant of that, and at some point do choose to focus down and to narrow down. Don't wait too long, but don't do it too soon. So simple, right? Okay, I think that's it for this video. I don't really have much else to say, but I really liked that lesson that guy taught me last night. And he wasn't teaching, you know, he was just talking. But make sure when you get in a room with people, you listen to them, because there's always lessons to be learned. It's cool. All right. Hey, thank you guys for listening and watching, whatever you're doing. And I will see you next video. Hey, subscribe to my channel. Subscribe to my channel. Okay, see ya.